I'm consulting on a mentorship case that is a perfect example of why surface level health advice doesn't cut it. We have a healthy 40-year-old male who strength trains 3 to 4 days a week with progressive overload, does cardiovascular activity, meets daily steps, nutrition, hydration, and mineral status, all on point along with his sleep. But we are seeing other things via his lab work, which warrants a deeper conversation about interventions that go beyond the day-to-day. So what we see here is we see that red blood cells, hemoglobin, hematocrit are on the elevated side. Some may say this is dehydration. We know this client, we know this is not the case. MCV is also elevated, so it's showing red blood cells are a little bit larger, but yet they're underpacked because MCHC is on the low side with hemoglobin. Translation, this is probably B12 folate, which is this is not an ingestion issue because he is taking methylated B complex. He also has a great diet. This is likely a transportation, absorption, utilization situation, to which may be the gut. We also know this gentleman does snore, so we do not think that there's obstructive sleep apnea at play, but having any form of even mild sleep apnea could disrupt that vagus nerve connection, to which, or vagal tone, I should say, to which could disrupt the gut, and we could be having some dysbiosis, which could be contributing to a negative situation. Now, the biggest thing that we saw that we wanted to dig into was actually his lipids, because we have been seeing his lipids over the course of several years that total cholesterol LDL-C was elevated. But we know that LDL-C and even total cholesterol, this isn't really telling the full story. Like, we really need to look deeper. So we did. So we looked at LDLP, which is the number of actual LDL particles. Higher number equals potential higher cardiovascular risk, regardless of where LDL-C is. We looked at ApoB, we looked at small LDL, to which these guys are really important because these guys are more likely to stick, oxidize, and cause damage inside arteries. We looked at LPPLA2, which is an enzyme that is associated with inflammation of the arterial wall. Elevation in that guy could suggest oxidation and potential risk later on. So what are we doing? One, educating the client on that his day-to-day matters. However, we need to dig in a little bit more. So we're doing that by working with his provider and making some suggestions that go beyond the day-to-day steps. We're implementing some suggestions with regards to his sleep and potential sleep apnea, looking at a calcium score, as well as having discussions with his provider about further support beyond his day-to-day. This is what I really love about coaching with regards to doing consultations and mentorships. Our coaches in that mentorship, they are next level. And this is the type of impact that clients are going to remember. They're going to remember coaches going well beyond what are your macros and are you meeting your steps. So if you have any questions, let me know, and I hope that you found this interesting.